From an England perspective, it's we partner with UK Anti-Doping and it's targeted testing.
Okay.
And from an RFU viewpoint, we don't want doping in any area of the game. So irrespective of whether you play senior international or level 10, if we think we hear you are doping or breaching the rules, we will come after you irrespective of what level you're playing at.
So how do you actually do that targeting? Are the whistleblowers telling you that these guys, some people are taking it, or what are the? Because it sounds like a pretty good practice actually for other sports.
Yeah, some of it's whistleblowing, some of it's paying attention to the media and what's going on within teams. Intelligence coming in from UK Anti-Doping in terms of packages of steroids or growth hormone that have entered the country.
Okay.
So it's not necessarily all from whistleblowing. A lot of it can come from law enforcement, intel sources from up and down the country.
Mm.
I think one of the things that I've tried to impress upon media, and it's really useful to be able to come to sessions like this, is that having an anti-doping rule violation should not necessarily be seen as a negative, because you're out there doing plenty of testing, plenty of education, and you're catching people, and that can only be a good and positive thing for the game. And I think probably what you must do is look at the demographic of players who are failing these tests, because many of them are not using these drugs to enhance their sport or rugby performance. A lot of it is about body image, and tackling that issue is as much a sporting issue as it is a public health issue.
Mm-hmm. I think recently the World Rugby reported there was no failed tests in their anti-doping programme.
I think certainly, are you referring to the World Cup programme or their programme throughout their year? So they do get failures, so they've had some in the sevens, they've had some players who perhaps were outside the current elite sphere, so they had a South African player who's playing in France fail last season. But in terms of their World Cup testing, you are testing the very best players who have been tested for many, many years. I think it would be highly unlikely that any of them would be doping.
You'd be an idiot if you got caught during the World Cup test.
Very peak of their professional careers. I think they've all worked exceptionally hard to get to where they are. I don't think they would be necessarily doping, and certainly not at a World Cup. So I believe the statistics that come out of World Rugby, I think the difference is World Rugby's programme is focused on that top 5% of players, whereas UK Anti-Doping are focusing on the next tier down and the next tier down. So that's where you're seeing failures. And I think one of the things people are doing is they are translating failed tests at a lower level of the game and saying, well, that must be going on higher up. But they're not looking behind the reasons why these youngsters are taking the drugs. As we've spoken about, much of it might be about vanity, whereas our senior players, they will do whatever is required to look a certain way. They've got experts like Graham to be able to refer to, they've got scanning and digging coaches, and they get the time to recover and eat and train properly between matches, which is what a lot of the guys lower down just don't get.
I was just going to add exactly what you said there, is that when you get to the top end, you've got some of the world's best strength coaches giving you advice of what training you need to do. You're staying in world-class hotels where chefs are producing magnificent food 5, 6, 7 times a day. You're getting advice from nutritionists, you're getting the supplements you need to support your training programme, you're getting the rest that you need. You're not having to go out and work all day and then try and cram your training in the evening. If we need to get size on somebody, we can train them 2, 3 times a day. There's no excuse not to get at that end in the optimal physical condition. What you've maybe got at the lower end where people are getting caught, one, I do think the aesthetics is a big thing, but two, they're trying to compete at a level that we see people doing with none of that, no real time to put the training in, having to work a full day, not being able to feed after work and come to training. So I just think to say that just it's at the low end, so it must be at the top end, well no, but there's a world of difference between the two ends.